South Africa is currently witnessing a significant surge in rubella cases, predominantly affecting children under the age of 15. Now, to shed light on this concerning development, we're joined by Dr. Mvuyisi Mzukwa, Chair of the South African Medical Research Council, to discuss the implications and how necessary responses required. Doc, good to speak to you as always. Now, provide an overview of the current rubella outbreak in South Africa and its severity compared to previous years.
Yeah, good afternoon to you, Hugo, and your viewers, and thanks for inviting me. Just a correction there, I'm representing the South African Medical Association. Yes, I agree. The severity is getting worse if you look at the symptoms that we've experienced before. But still, we still see, the rash that we see in children, usually starting from the face, going down the neck, and the whole body. But also we've got other symptoms that you see with rubella. For example, you may find a low-grade fever, you may find a cough, a sore throat, a runny nose, headache, pink eye, joint pain, but also you could have swollen lymph nodes on the neck and other areas. So that's what we see at the moment.
Now, for those that contract rubella, is it curable? Can some of those symptoms be reversed by taking any medications?
Well, Hugo, rubella is mild in children, but it depends. If, for example, a mother contracts rubella, during pregnancy, it could then spread to the child, via the placenta, and causes, what we call rubella syndrome, or congenital rubella syndrome, where you find that there's congenital abnormalities of the heart, abnormalities of the lungs, abnormalities of the brain, leading to obviously challenges with cognition there. So that is the most dangerous one, if the mother who's pregnant gets a transmission to the child.
Now, why children under 15, especially those in that 5 to 9 year age range, more susceptible to the current surge in rubella cases?
Well, I think the greatest challenge, Hugo, that we've had is, first of all, during COVID-19, the vaccine hesitancy has caused people to not really visit healthcare facilities for vaccination. And that included the usual vaccination that's given to children. So that is what we're struggling with at the moment, to encourage people to come forward, for vaccination. But the other thing is the surveillance rate may have gone up, in some provinces, easily picking up the symptoms of very suspicious when they present in. But also, there's this natural cyclical pattern that we note with rubella. It might be that time at this point in time. So it's a number of factors that is causing this.
So what progress has been made now in the rollout of the combined measles rubella containing vaccine, and how is it expected to curb the outbreak? Because this is critical.
Well, it is important that we really get all the children to come for vaccination, and so that they protect each other, but also we curb the spread of this, because this is freely available in the state, and also, if you go private, you also get it. So it is important that we protect, especially the pregnant mothers. They need to understand that they need to be screened for rubella, so that we prevent the complications that we normally experience, with the pregnant ladies. So we really encourage all of them to, if you are planning to get pregnant, I think it is important that you go for screening, but in pregnancy, you might need to be screened so that we are sure that you are safe, your pregnancy is safe.
And finally, what steps are being taken to raise public awareness? Because I'd imagine that this is key. In light of the fact that during COVID, there was almost a shift away from people going in for vaccinations.
Well, I think the NICT has done well, because they did the surveillance, and when they picked up the rise in numbers, then they alerted the Department of Health. And the Department of Health now is rolling out a plan in terms of vaccinating people, but also the awareness that you are talking about, making sure that people are aware, and also people are encouraged, to go and vaccinate their children. But they, even the pregnant ladies are encouraged to go for screening, because this is quite important. But also, Hugo, I would like to encourage people who are symptomatic or already contracted this virus, that they need to go for a medical attention. We know that this is self-limiting, but symptoms at times can become severe. They need to be treated, by healthcare experts.
Now, final question. It is contagious. Just how much is it likely to spread and impact people during this time when there's a lot of travel courtesy of the holiday season?
Well, there's, like you correctly put it, there's a number of issues at this time. There are family gatherings, there are, festivities around in the country, but also, like you said, there's lots of traveling at this time. So there are chances that people could contract this. So we encourage them, those that are symptomatic, to be, investigated by health officials, but also to protect those people that are around them in terms of putting on a mask, washing their hands, and also trying to isolate themselves, from the rest, especially if you see that rash, that usually is a prominent symptom. So we really would encourage community members to really protect each other at this point in time.
South African Medical Council's Dr. Mvuyisi Mzukwa, appreciate your time talking to us about the spread of rubella in the country at the moment. Now,